Let me ask you something strange. How did the first human know that a leaf could stop pain? Or that a root could reduce fever? Or that a flower could calm anxiety? Because plants don't come with labels. There were no laboratories, no microscopes, no clinical trials, just forests, just trial and error, and very high stakes. So how did we discover medicine before medicine existed? Let's slow down and figure this out together. Long before written history, humans were already experimenting. Not because they were scientists, because they were sick. In early human life, infection could kill you. A simple wound could become fatal. A fever could wipe out an entire group. Survival demanded solutions, and nature was the only pharmacy available. But here's the interesting part. Humans didn't start by randomly chewing leaves. They watched animals. Even today, animals self-medicate. Chimpanzees have been observed eating bitter plants when they're infected with parasites. Elephants chew certain bark before giving birth. Cats and dogs instinctively eat grass when they're nauseous. Now imagine early humans doing the same, carefully, seeing patterns, connecting behavior to recovery. If a wounded animal repeatedly chewed a certain plant and recovered, that plant suddenly mattered. Observation was the first laboratory. Then came experimentation. And this is where things get uncomfortable, because early medicine wasn't gentle. It was trial, it was failure, it was sometimes poison, some plants soothe, some kill. And ancient humans had to learn the difference the hard way, through generations, through memory, through stories. A grandmother telling her daughter, "Not that berry, that one makes the heart race." A healer teaching an apprentice, "This root must be boiled, raw, it burns the stomach." Knowledge wasn't written, it was inherited. One of the earliest known medicinal plants is willow bark. Ancient Egyptians, Sumerians, Chinese healers, and later Greeks all used it to treat pain and fever. Thousands of years later, scientists discovered that willow bark contains salicin, the chemical ancestor of aspirin. Think about that. Humans were using natural aspirin long before chemistry existed. Not because they understood molecules, because they understood results. Pain decreased, fever dropped. That was enough. Garlic is another example. Used in ancient Egypt, used in China, used in Greece. Modern science shows garlic has antibacterial properties, but early humans didn't know about bacteria. They just knew wounds treated with garlic rotted less often. That's pattern recognition. That's data. Without spreadsheets. And then there's opium. The opium poppy was cultivated as early as 3400 BCE in Mesopotamia. Ancient civilizations used it for pain relief. They called it the joy plant. They understood its power long before modern morphine. But here's the complexity. Medicine and danger were often the same plant. Too little does nothing, too much kills. Ancient healers weren't just discovering medicine, they were discovering dosage. That might have been one of the hardest lessons of all. Now let's move east again. Traditional Chinese medicine developed complex herbal systems over thousands of years. They didn't isolate single chemicals. They combined plants. They observed balance, hot and cold properties, yin and yang. Whether you interpret that spiritually or biologically, what matters is this. They documented effects carefully. The Sheneng Ben Cao Jing, one of the earliest Chinese pharmacological texts, classified hundreds of herbs based on their observed impact. That's pharmacology without microscopes. In India, Ayurveda classified plants by taste, energy, and effect on the body. Turmeric was used for inflammation, ginger for digestion, neem for infection. Modern research now confirms anti-inflammatory and antimicrobial properties in many of these plants. But ancient healers didn't need double-blind trials. They needed survival. If a treatment consistently helped across generations, it stayed. If it killed, it disappeared. That's evolutionary medicine. And then there's something deeper. The social role of the healer. In most ancient societies, the healer wasn't just someone who knew plants. They were observers of the body. They noticed who recovered quickly, who reacted badly, which treatments worked better in children, which herbs shouldn't be mixed. Over centuries, that observational database grew, quietly, passed down orally, until writing systems allowed preservation. Egyptian papyri, Greek medical texts, Islamic Golden Age scholars documenting herbal knowledge, medieval herbals in Europe, each culture adding layers. But here's something fascinating. Early medicine wasn't purely physical, it was psychological too. Ritual mattered, belief mattered, trust mattered. When someone believed a plant would heal them, stress dropped. And stress affects immunity. So sometimes healing wasn't just chemical, it was contextual. The first medicines weren't just plants, they were systems of meaning. And then, slowly, chemistry entered the picture. In the 19th century, scientists began isolating active compounds from plants, morphine from opium, quinine from cinchona bark, aspirin from salicylic acid, digitalis from foxglove. Suddenly, medicine shifted from whole plant to isolated molecule, from observation to laboratory precision. But here's the twist. Modern pharmaceuticals still rely heavily on plant chemistry. Over 25% of modern medicines are derived from plants. So in a way, we never left the forest. We just refined it. Now, step back for a second. Think about the courage required for the first person to try an unknown plant. Think about the patience required to track effects over years. Think about the intelligence required to distinguish coincidence from cause. The first medicines weren't discovered in universities. They were discovered in desperation, in curiosity, in observation, in watching nature and asking, what happens if? And that question might be the most human thing of all. So here's what I'm wondering. Did ancient humans discover healing because they were experimenting blindly, or because they were paying closer attention to nature than we do today? And if we were dropped into a forest with no labels, no pharmacies, no Google, would we be able to rediscover medicine from scratch? Because the first pharmacy wasn't a building, it was the wild. And someone had to taste the first leaf,